Dr. Dolea, thank you very much for being with us first.
Thank you for having me.
And let's start with a really most basic question people may have asking themselves. Should I cancel my travel?
No, no. So during this coronavirus outbreak, WHO has specifically said that there shouldn't be any travel or trade restrictions. This includes most places in China. The risk of being infected is low in many countries. The epicenter is still, as we know, in the Hubei province in China. Some countries, we know that they have issued quarantining of people coming home. This is usually based on a risk assessment identified by individual countries. Travelers should not really cancel their plans, but they should take into account the various restrictions that airlines have put in place when planning for their next trips. Thank you, Terry.
Is cabin environment, plane cabin, dangerous in any way?
No, absolutely not. We know that the virus so far is transmitted via droplets or fomites, which means a close contact with people that are infected and that are shedding viruses. It is possible that the virus can live on surfaces as well, but for a short amount of time. The best thing to do in a cabin is to practice proper hand hygiene, to wash hands properly with soap and water, or to use alcohol-based rub, and to use coughing etiquette, and to really keep the distance from people that are coughing or having symptoms.
Well, you already answered my next question about measures people can take, but how different it is from what we recommend, let's say, for seasonal influenza?
Is not different at all. Similar to the seasonal influenza, people should be practicing the regular protection measures for respiratory infections, which means, as I said, coughing etiquette. Make sure you sneeze and you cough into your elbow. Make sure you use a tissue when you sneeze or cough, and you throw away this tissue in a bin. Make sure you keep your hands clean, and make sure that you also prepare your food using the regular food hygiene practices.
Now let's talk about a very important group of people. That's people working in airplanes, cabin crews. What they should do, what precautions they should take?
They should take similar precautions as the passengers. In addition, they should also be aware of the guidance that airline cruises and the crews of airlines have put in place through the IATA, the International Association of Airline Transportation. They also have the need and the requirement to care for suspect cases in the plane, and they have specific guidelines on how to do that. Meaning isolation of suspect patients, meaning keeping distance from passengers that may be in contact with them, providing the passengers that are suspected cases with regular materials for proper respiratory hygiene, meaning providing them tissues, allowing specific places for the passenger that may be sick in the plane.
Now, we see lots of people using masks. How effective those masks are?
The masks are very effective for protecting people that are sick from preventing them to shed the virus or to transmit the virus onward. For people that are not sick, masks are not very effective. It's also important to make sure you use the mask properly, and to not touch the exterior of the mask, even if you are not sick. The masks are also important for people that are caring for sick passengers, which is sick travelers or sick people, which is the healthcare workers. So it will be important that people that most need these masks have the access to the masks.
Thank you very much. Now, we see lots of stigmatization of people of Asian origin during this novel coronavirus outbreak. So, question we get, for example, I see lots of tour groups from China. Should I be worried?
No, not at all. The virus originated in China, in specific provinces in China, and the Chinese authorities have taken extraordinary measures to protect the world for spreading externally the virus. That means that people from other provinces are not at high risk, and they shouldn't be discriminated or stigmatized for just being coming from a country that has one province with large numbers of outbreaks.
What precautions should be taken by airport workers?
Airport workers should practice the same hygiene protection measures as for any other workers. For the moment, we know that the virus can subsist for maybe half an hour on external surfaces, but this shouldn't. There's no evidence that the virus can be transmitted by just touching the luggage of other people. So airport workers should also be aware of where they can have the protection equipment. They should be aware of the rules and the procedures that are in place in the airports in line with the regulations of international health regulations, and should themselves protect themselves from getting the virus through the regular measures that we have mentioned before.
Thank you. We'll continue with our questions. We are receiving lots of questions from you watching us on our Twitter account and on our Facebook page. Some of those questions I see we have already answered. Maybe we will answer others, and we will try to get few of yours. Next question is, what about hotel rooms? People who are traveling, what precautions they should take when being in a hotel rooms during the travels?
Being on travel in a hotel room is similarly an issue of practicing personal protection measures. So it should be careful to wash the hands properly, to use alcohol-based rubbing of the hands. Make sure that the food hygiene practices are also taken into account. And there is no specific requirement for being in a hotel than being in any other place while a traveler. Similar protection for regular people or regular travelers have to be taken for any as if for any other type of respiratory infections, as we mentioned before.
Should I avoid crowded places like airports in general?
If you have to travel, you have to go to the airport. However, if you want to reduce your risk of being infected, it's true that staying away from people which may be suspected cases, it may help you to reduce your risk.
This is a very interesting one, and I think it would be really good to answer. If I was on a flight with someone who was subsequently confirmed as an infected person with the novel coronavirus, what should I do?
As a passenger, and if somebody in your plane has been suspected of having a coronavirus, the passenger crew knows the rules, the procedures, and they would ask all the passengers sitting 2 rows behind or 2 rows ahead of these suspect cases to fill in what they call a personal locator form, which is a form where you provide your contact details in case the authorities need to contact you. If you indeed need to be contacted as if the case turns out to be positive, you would then turn to be a contact of a case, and you would need then to take precautions yourself and monitor yourself for 14 days for symptoms like fever, coughing, shortness of breath, or general fatigue.
And we were talking so far about planes, but we get questions about cruise ships. So the question is, how about cruise ships? Should those travel plans be cancelled?
No, it's a similar situation as with the planes. If precautions are taken for the cruises, particularly to have on board of the cruises a preparedness, have preparedness measures on board of the cruise and be able to provide attention to the potential suspect cases on the cruise ship, these trips should not be cancelled. And we are in discussions with the International Maritime Organization because we know that a number of ships are now in a difficult situation because of cases that have been detected on board of these ships. And we are discussing with the authorities from the International Maritime Organization how to address best the situation of the people on these ships.
Thank you very much. We may now try to answer some questions from the public, and questions that come regularly. You already touched upon that, but people want to be clear, is this airborne virus or it's just droplets?
This is droplets. this is not an airborne virus. The virus is transmitted via droplets from people that are coughing or sneezing, and they are at very close contact with somebody. So for the moment, we know that the virus is not an airborne transmission.
Thank you. We have a question from Bien Tu. How to protect a baby on an airplane, given that baby cannot wear the mask?
The baby should be protected by the parents in the same way that the parents are protecting themselves. So keeping them away from people that may show symptoms, that may cough or sneeze. Try to keep the baby close to the mother or the parents so that he or she doesn't get into contact with suspect people on the plane.
We get a couple of questions on hand hygiene. So, for example, Mahmoud Mohammed Amar is asking, is it enough to wash hands with the tap water, or it must be washed with the antiseptic products or alcohol rub? We have another question from Nigeria, from Folorunso Adulamo, saying how many times per day we should wash hands?
You should wash your hands as long as they get into contact with dirt. So for the hands that are dirty, you use soap and water, and you wash them properly. As for any type of hand hygiene measures. If your hands are not dirty, you can just use alcohol-based rubbing. So it's not a matter of fixed how many days, but as long as it is required for you to keep a proper hand hygiene.
Now again, we go back to the cabin crew members, and Laurent Smart is asking, what are the risks to cabin crew in enclosed environments? So cleaning toilets, close contacts with the passengers?
Yeah, so cabin crew should protect themselves first. If they suspect that there are cases on board, they also have to have available the necessary equipment for self-protection and the necessary equipment for protecting additional passengers. And these come into the standard procedures of IATA. So before traveling, the cabin crew should make sure that they have protection for their own personnel, as well as additional protection for people that may become sick on board.
We have John Zedrick asking, how many days are the incubation period for this virus?
The maximum incubation date is 14 days, but we've seen studies that show that it can be between 2 and, on average, 5 days. But the maximum period to be on the safe side is 14 days.
We have Saidul Islam asking, I think, important question that many people are asking. So, can we get the virus without any contact with infected person?
No. People that are infected, they can transmit the virus. People that are symptomatic, they can transmit the virus. There's no such a thing as a truly asymptomatic person. Even people that may not show immediate symptoms like coughing or sneezing, they still may have some subclinical symptoms like subfever or something. And in those cases, which we're now even studying in the situations where some examples have been mentioned, in those cases it may be possible, but it's not fully asymptomatic person. So the person may have, for somebody to transmit the virus, they have to have some kind of symptoms.
But maybe just to clarify that when we say that the droplets may land on a surface and that may survive a little bit, what do we know about that?
We know that the virus can survive for about 30 minutes on surfaces of objects and so on. But we also know that with the proper protection, hand hygiene protection, we can even prevent that we get the virus from surface contacts.
Now we get a number of people asking specifically about Asian countries, like is it safe to travel to China, to Singapore, to Thailand? We know that in China, in the province that has the largest number of cases, there are measures implemented by the Chinese authority to protect the citizen and to prevent the exportation of the virus. So those regions, for planning purposes, people should avoid going to those regions where there are already, or take into account the restrictions that are in place. For other countries, it's safe to go
by taking regular protection measures. But also, it's important to check with the airlines, because we know that some airlines have reduced or actually suspended the flights in some of the Asian countries. And we are tracking this information very closely.
Again, lots of questions on wearing masks, so maybe you may repeat what you have said, because people are asking, okay, I'm wearing the mask, and then I'm asked at the immigration point to take it down. So really, what is the advice? Because you see some people wearing masks, others don't.
Yes. As I said, the masks are important, are very important for people that are sick, because it prevents them from infecting other people. In some places, for cultural reasons, there is the necessity or the intention that many people wear the mask to protect themselves. But as we said, it doesn't really protect the people that are not sick. Having said that, even if you decide to wear a mask, you should know how to take it down, how to put it on, how to take it down, so that you don't get them infected by touching the mask unnecessarily. What we also know is that when people that return from China or from other places and are asked to self-quarantine or to self-isolate at home, to check and self-monitor for symptoms for 14 days, if you have symptoms within this period of time, you need to call your immediate medical emergency clinic. And if you go to the medical facility, you have to wear a mask so that you don't infect the people in there and the people you are traveling with. Because if you have symptoms, you already seem to be probably having the disease.
Thank you. Interesting question from Bagong Bayani. He says, since people need to bring alcohol products or sanitizers, can security arrangements of airports be amended to allow passengers to bring more than 100 milliliters on their carry-on bags?
That is the question that we need to discuss with our IATA colleagues. For the moment, the products, the alcohol products, are available in small bottles of 100 milliliters, and you don't really need for a long travel more than that. So that is what we can say at this moment.
Again, question, I think you partially answered, but if I had a close contact with someone who has 2019 novel coronavirus, what should I do? If you know that you have been in contact with somebody that was diagnosed with the coronavirus, you should monitor yourself for the symptoms for 14 days, because you may have been infected, you may have gotten the virus from this person that was positive, but while monitoring your symptoms, as we said, check your fever, your temperature, morning and evening, see whether you get any fever, shortness of breath, or any other symptoms or cough. Contact your health facility, wear a mask when you go there, and make sure you don't get in contact with other people if you suspect you may have been infected as well. We have another question from Gitsara Pereira about airline staff. We mentioned cabin crew staff, we mentioned workers at the airport. I guess this applies to airline staff as well.
Yeah, exactly. The same advice, yeah.
Okay, so the other question is about droplets. So what is the advised distance we should keep to avoid this contact with droplets?
We advise 1 meter distance. So that's what we can say at this moment. Coughing closer than 1 meter, droplets can stay in the air, and they can be transmitted and inhaled by the people with whom you are in discussion or with whom you are close by.
We get more questions on air and possible aerosol infections. So we have Amin Hashim asking, is the air that we breathe in an airplane safe? Then Sachin is asking, what about aerosol infection? Is it possible? So just to repeat again,
yes,
although
exactly.
we answered those questions.
We answered already, but just to say that the air in the cabin is actually clean and circulated, that there are specific systems to ventilate the air in the airline cabins. And as we said, for now, we know that this particular virus is only transmitted via droplets, so not airborne.
Okay, and that I assume when you talked about droplets surviving for a certain amount of time, that also talks about lavatory and bathrooms in a plane and how safe they are.
Yeah, it's as long as you take the precautions, you wash your hands properly when you go to the bathroom, you use your alcohol-based sanitizer or to rub your hands if you need, then I think it's okay as a protection, self-protection measure.
So I think questions we are coming are more or less along those lines that we already explained. So maybe just before we conclude our discussion, maybe one final word and key message for people around the world who are watching us and who want to or plan to travel.
Yeah. So the key message is you should not change your travel plans if you have plans to travel during this time. You should be aware of what countries have put in place in terms of restrictions and plan your trips accordingly. And you should make sure that you practice the hygiene and the hand hygiene and the respiratory hygiene as advised by WHO and by your practitioners, to practice proper coughing etiquette, to wash your hands properly, and to really use the similar measures that you use for any type of respiratory disease like influenza, for example, or any other coronaviruses.
And maybe one message for our very important colleagues who work at the airports, who are working in airplanes and who are working for airline companies.
Yeah, we also understand that they are also under a lot of stress and duress during this time, and we appreciate all the efforts that the airlines that are still maintaining the flights are providing, the efforts and their dedication they provide. We know that they also have the measures and the standard procedures in place for the crews and for the taking care of the passengers on board, and we appreciate their interest and commitment to apply all these procedures that we are also advising.
Thank you very much. I would like to thank Dr. Carmen Doler, who is the head of WHO Secretariat of the International Health Regulations, for these extensive answers. I hope this was very helpful to all of you who were planning or plan to travel. We would like to thank all of the viewers who watched us on our platforms, Twitter account and Facebook Live. I understand that we had people online from India, Philippines, China, Nigeria, Cambodia, Afghanistan, Qatar, New Zealand, Emirates, Kenya, Afghanistan, South Africa, Italy, Papua New Guinea, Australia, Botswana, Vietnam, and many others. I wish you a very nice day and hope to see you soon again. Thank you.
Thank you.